We're all set.
Okay. All right.
We're doing business.
We're on the clock, ready to go, so I'll call this meeting to order of the DeKalb County Commissioners. Today's date is August 21st, 2023. Good morning, everyone. Mic's on, and away we go.
Good morning.
Good morning, Dottie.
Yes. Well, it's not the Larry and Dottie show again. Larry's taking care of flowers. So anyway, I wanted to start off with something. I was contacted by the United Way last week. They would like to know if we would like to do a, be a part of their fundraising efforts in years past, really past, very far past.
Very.
Very far past. The county employees were afforded the opportunity to make donations to the United Way. It got to the point where we had probably less than a handful of people who contributed, and it just kind of went by the wayside. And so they contacted me last week, and I said that is something that I would have to run by the commissioners to see if that would be, part of their, their campaign to solicit funds from, employees throughout the county. And so anyway, that's what I'm going to ask you. Is this something that we want to promote? It does mean an extra deduction for our payroll if an employee does decide that they want to be a part of it. There's the distribution of information that we have to do. So it's not without some effort on either payroll and HR's part. And then there are definitely some, in my previous life, management chose not to do it because they felt that employees, if they wanted to do that on their own, they could do that on their own. So anyway, I'm just laying all of that stuff out for you. I know that there are lots of other companies here in the county who are a part of it. So what is your wish for me to take back to the United Way?
What's your thoughts, fellow commissioners?
I think if they want to make their own donation, they can. And I don't think we need to add it to our workload we're already got too much work. I think it's just another operation we don't need. But I think it's a good organization, and I encourage anyone to give money to them if they want to, but it's not too hard to write a check and just send it to them. Mm-hmm. It's a lot harder for us to deduct it out and keep track of it. And
I think for the few that would probably sign up to do it, it's not worth the payroll time and deducting, sending, matching, and that's kind of why it went away prior, because there just wasn't enough that was doing it.
Well, if you don't have the champion to really promote it and work with the team, like SDI and technology,
Right, yep.
Because it's a big deal for them.
Yes, yep.
If you don't have that, you end up with just a handful of people.
Right,
Really,
yeah.
I'm a big supporter of United Way. It's a great organization, but I'm really hesitant to dump anything else on the payroll system.
I agree.
Without we either do it right or don't do it.
Right.
Yeah, I think we're unanimous that
Okay.
they want to give, they can do that on their own. We don't need to run it through payroll.
Okay.
Yeah.
Okay, all righty, I will get back to them. Okay, last week, council met, and I ended up with a bunch of assignments to some homework. The Job Classification Subcommittee is going to be meeting on August the 29th, and council asked this subcommittee to work on several things, and one of them is that full-time maintenance position to be shared between the three departments. So I think we're good there. You guys have already approved it. Council wants a little bit more information. So that group of three department heads, they put their heads together. They've already been, working on it. And so there will be more of a presentation of how it's going to lay out and also the costs involved, which is what, council really needs. And we'd need to do a job description, for it and go through that procedure. They are also going to be talking about highway wages. We don't have to worry about a new job description there. This is just simply, okay, what are we going to do to try to attract more CDL drivers, if that's even possible. So then they will talk about the public defender. I know we've already talked about the public defender's office would like to offer benefits to his part-time attorneys. And so that will be discussed. He pretty much has given council and the subcommittee a lot of information, but he still has a bit more. So trying to make his case. He is an attorney, so he's making a case. And then the health department, Cheryl and the money coming from the state, she feels that they will need a school liaison, and that person will probably need to be an RN to be able to handle everything with all of the schools here in the county. And that would include St. Joseph over in Garrett and Lakewood Park. So it would be all of the public and parochial schools. But she needs to ask you if you will approve another employee for that department. And I know she's in at 9. I'll stick around and, we'll be able to talk about that. She presented her case to council, and there's a lot of money, and it needs to be handled really efficiently, and a lot of that money can go, to partner with the schools. And she feels that the best way to do that is to have somebody in her department handling that coordination with all of the schools, rather than doling out the money to each of the schools to be to take care of the responsibilities that are required by the state, and the reporting and all of that to come back. But I know that she will make her own case with you, but that's going to be one of those things that we will need from you, really, before the Job Classification Subcommittee could really act on it.
Have there been any discussion with the schools about that? Because,
Yes, they've had,
all right.
yeah, so
'Cause
Cheryl
they all
will be able
have
to.
nurses, obviously.
Yeah.
Yeah, all the school nurses are already busy.
Yeah.
What more are they going to add to their plates? And yeah, like I said, Cheryl will know a lot more about it. So Cheryl, we were able to hire the nurse for that basically first deputy position, and her first day is today. So we're very happy about that. There was perhaps a little bit of confusion with council last week. They thought that maybe this new person would be able to take on those duties, and Cheryl pretty much shut them down that position was already very busy with all of the emergency management, budgeting, being second in command of the health department. And so she will be able to talk more about that. The prosecutor's office is going to be reviewing one of their job descriptions, but then they also want to create a new position. And so the prosecutor, I have informed him that he will need to come to you to request that new position. He doesn't need to, request that for the redo of a job description within his office, but then that will have to come through the job classification subcommittee. There will have to be, a new job description written for that other position, and then a new job description for the new position, which, to tell you the truth, I'm not sure what that position is going to do. I came in on kind of the middle of his presentation. IT, where they're also going to talk about that, focusing on, the staffing for that department. I know Jack and I are going to be talking about that. He has, he's talked to you guys about his plan and, what will we need to do? What will the job classification subcommittee have to do? What will council have to do to work on salaries for that department if we are to compete with the private sector? Looking at, you can't just look at other counties and what they do, because the other counties, we have many that have one person in charge and they farm out all the other duties. So our department is definitely unique, very customer service oriented, and how do we keep that going and keep us all safe, all of our data? So, big department that we've, lots of things to work on. He's not asking you for yet another position. He's already done that. So those are the things that the subcommittee is going to be talking about, and I'm still gathering a lot more data for them to sort through and for the department heads to sort through. So anyway, we'll see what happens with that. That's August the 29th. For recruiting purposes, we still have the merit deputy open. That's open for yet another week or so. I have received requests for application packets, and we've kind of changed their posting so that individuals, like when I have posts outside of our county website, the whole application is actually on the website. So we kind of try to gear people to go that direction, and yet HR still gets, requests. So now, if they actually submit the, application, that's, the biggie. Told you last week that Ben and I had talked about changing the, and we did, we changed his recruiting posting so that the individuals don't have to stop down at the highway department, and they can just request the application directly from me. I wish I could tell you that increased our traffic a lot. Like I said, I wish I could tell you that.
Probably not so
It surely
much.
can't hurt.
Not so much, no. That just, yeah, so anyway, yeah. Of course, development services, the new code enforcement official, I think probably Chris will bring him in next week, introduce him. And Rhonda will be bringing in her new VSO, Brandon Lee, assistant VSO, to introduce him to you guys. And if I'm not mistaken, I think today is his first day also. He came in for onboarding already. And so excited about him starting. Sunny Meadows, they have a housekeeper who's going to be going down to part-time, so they still need a third shift part-time. And weekend coverage also, so we're still working on that. And probably last is the probation officer for community corrections. I haven't heard back on that one, but they have had some very good resumes come through. Now, whether or not they come through as well in person, So you have that. Another thing on my list is our work comp claims. try to fill you guys in every so often. As of when I received this, we had 8 open claims. However, now we have 10 because the sheriff's office had training last week, and 2 of the officers have injuries from training. So I do believe that brings us up to 10 open claims. So that would mean that 9 of them are from the sheriff's office, and we have 1 from community corrections. So I, once again, I've given them the contact information for the person at IPEP who specializes in law enforcement, just to see if there's something out there that we can do. I know that there are plenty of times that there isn't anything that we can do. You know, all the training in the world won't stop, a prisoner from doing something and they hurt themselves. But I'm hoping maybe they can help us with, as we are training our officers, to try to keep that down. It's not the first time that we've had officers hurt during training. And, it'd be nice if they were trained and not injured. So anyway, that's what we're working on in HR. The health plan, just kind of an update. We had our biweekly phone call with UHC Surest, and had just a few hand-holding cases that Trey, our rep, is working on with our members, and some of the ones that he had been working on have fallen off the list, which is always good. We have almost his whole time filled up. He will be here September the 7th, and we let employees know last week that he was going to be here and to set up an appointment through me, and so that's great. We have some employees who are not on the list of issues that he's working on. So evidently they are thinking ahead, or they just have questions. So whatever it is, and so it'll be a private conversation with him, and then he will, as needed, get with me to figure out what we can do to help these cases. Let's see, trying to think. We're still having, poor payroll and HR dealing with invoices on the dental vision disability life side, working through those issues. Just kind of frustrating. At least the UHC ones are, it's a lot easier. But anyway, thanks to Teresa and Susan and Lindsay, they're knocking their heads up against, what they are, and we're making headway. So anyway, yeah, that's kind of what's going on. What do you guys have? I know, we've got a lot going on. We always have a lot going on, but,
You still got 10 more minutes, Dottie.
I know. What else can I tell you? I could do a tap dance. No, my tap dancing career's over because of that fracture. Let's see. The safety committee will be meeting in September. Working on, actually, at the department heads meeting coming up on September the 6th, we are going to have a discussion about OSHA and training of employees, and working to just continue training our employees in what they need trained in, figuring out what every department really needs. And if there are extra things that they need, we'll get on board with them. We've been talking about fire extinguisher training, and Ben Parker is a former volunteer firefighter, and we will have a current firefighter in our new code enforcement official, and maybe we can pull them into service to help us do some trainings on, the correct usage of a fire extinguisher, which could happen to almost anybody. We have a small fire someplace, and it's like, oh my gosh, what are we going to do? You can't wait for somebody. You have to pull it off the wall, and know how to spray it correctly. So it's not that difficult, but you've got to know how to do it. So that might be another one that we have coming up. I put our person who does the training for CPR in touch with Sunny Meadows to make sure that Sunny Meadows is covered. We have a lot of new employees out there, and they may just have a class of their own, is kind of what they're talking about. So that would be great. And we keep going on safety, and because it's so important. We want our people, they come into work, we want them to be able to go home again.
Okay.
Yeah, good.
Anything for Dottie?
Think of.
Okay, great.
All right.
All
Thank you,
righty.
Dottie.
Okay, sounds like I just saw we've got,
Yeah, we might as well get them up and keep on a cruise unless you need claims or something done sooner than later.
Claims is always a good thing to do.
Yeah, let's do claims.
If it can be done.
I'll just move to approve the claims. How about that?
How about that?
I will second.
I have a motion and a second to approve claims. Any additional comments? All those in favor signify by saying aye.
Aye.
Aye, opposed, the same? There you go, claims are approved.
Thank you. I do have one. Did you see I had sent you the second draw for the highway?
Right.
So if we
Yeah.
could do a separate motion for that claim, I'm just keeping them separate for reporting.
I'd move to approve the separate claim for the highway.
Thank you.
Second.
A motion and a second on the floor, comments? All those in favor signify by saying aye.
Aye.
Aye, opposed, the same? Pay the highway.
Thank you.
Want to do payroll while we're here?
Let's do payroll. Got
Oh, why
Move to
not?
approve payroll.
Second.
a motion second to approve payroll, comments? All those in favor signify by saying aye.
Aye.
Aye, opposed, the same? Payroll is approved. Well, heck, let's just do minutes.
you're on
Move to approve minutes.
Oh, okay.
Another second.
We have a motion and second to approve minutes. Comments? All
Bill,
those-
I know you found something wrong in them. You always do, so what?
I read them with one eye shut, so I didn't catch nothing. Okay, motion and second to approve minutes. Comments? All those in favor signify by saying aye.
Aye.
I know.
Opposed, the same. Minutes are approved. All right, Cheryl, come on up.
Morning, Cheryl. Yeah, we heard.
And she is my new first deputy
Yes.
and
Welcome.
registered nurse.
Thank you so much. I appreciate it.
I thought I would bring her today. So
Welcome aboard.
Thank you so much. I appreciate it.
I did send some documents to you. I wanted to just quickly go through what I've been looking at. I wanted to get you guys, the council, and the board all up to where I am so that you can see what I've been working on and the expectations. So the one thing, and I have to apologize to Susan in regards to the budget, because for some reason I was thinking that they would see it up there. I'm going to give you a copy of the budget thank you. That's the budget as it is right now.
Thank you.
If you refer to your packets, the first page is just showing the match. It looks like this. it has a total at the top. It says that the minimum amount,
Hey, Cheryl, I didn't receive that. Did you send it by email, did you say?
or no,
With Susan's stuff that she sent out. So it's with
Oh,
our meeting
okay.
documents.
I'm sorry. I will look it up.
oh, okay.
Go ahead, go ahead.
This first page, the only thing that I wanted to bring up is I know we've been talking about the county match, and they were mentioning the $611,704. That's not correct. Susan and I, but especially Susan, went to the state, talked to a top person. Our match is really looking like the $252,858 I've listed. So we're well in the means of being able to cover that. This slide, this is, I copied that for the council because this position is required. And I just wanted to make sure that they realize this came out of a slide deck that we get as a health department. So I just included that. It talks about it, basically to say it's required. We don't have a choice in having one. The next one is pretty important, and I'm sorry, there's a lot of writing on there, but I thought it's probably better for you to see the things that have gone through my mind. This is what, like a working document for me over the last several months. Things to look at are the shalls and the shoulds. This tells you what we're expected to be doing with this money. So I thought it would be good for you to see it, and you can call me if you have additional questions or call me back or whatever, but this is what the basis of everything I'm doing in this budget. And I should mention the core, it's called the core services, so I'll refer to that often. Each core has things that should or should not be done, and that's key too. There's things that they want us to do. We don't necessarily have to do everything, but there are things there that are very specific. One of the cores on there is the fatality review. And I just wanted to point out, when you look at that, it's on the first page of the cores. The committees and stuff that they're talking about, there are actually 3 committees. And we're responsible for gathering information. We're responsible for forming these groups if we don't already have them. There's reporting that, of course, has to be made from this stuff, actually from all the cores. But when you look at that little core area, it may not look quite as daunting, but when you start looking at what's required for each committee, there's time involved in that. So on the budget itself, when we get to that, there is the new fund number is 1161, and some of the boxes didn't have, Susan and I could see what was in the boxes, but it wouldn't print off. So I actually printed for you the dollar amounts I was looking at and the programs it would cover. And if you look back onto the core, you'll see why I put them in here. They're things that we need to be doing. And on this page, I want to point out 2 of the higher funded programs through Parkview and St. Martin's. Those may have to be adjusted as far as money, because I know the council is looking at utilizing part of those funds for salaries. So those are going to change. And what I would do is just be in touch with them and tell them what I want them to do, and then offer them a dollar amount. And of course, there's going to be more money as the years go on, so we can hopefully start funding all the programs eventually. But that gives you an idea. Those are all the programs that I've funded in the budget. This Parkview assistance page that you see, that talks about all the different things that they felt they could help with. And this is the one that will have to be probably shaved down in the beginning, and then we'll just work up to more expansion of services as the years go. Just so you can see what we've kind of talked about. The why, got a hold of Bob Kraft. I wanted, and I want to say too, that Parkview has some programs that are not just specifically for people that are low income, but everything else is. It is geared towards people that are low income or no insurance or underinsured type people. So we've geared this money towards those kinds of things. And on the Y at the bottom, you can see that for $16,000, one of the programs I wanted to be addressed was diabetes. And that first line for the $5,000 would put 31 adults into this program. And it would be comprehensive with exercise, dieting, and all those things. The other one, the 11,000, could fund either 50 families or 250 individuals for a Y membership. And I told him that I wanted to have some type of input from the people involved in these programs. So the Y will be $5 a month for membership, so that they at least are contributing towards that. This conversation was again about the school liaison, just trying to make sure everybody knows what it's about. At the top, it says conversation with Lori Ramsey, the chief.
What page are you on? I'm sorry, Cheryl. Where are you at?
We got all of these as individual documents.
Yeah, they're all over the place with ours, so I'm trying to.
I'm sorry. The other one, this one is the conversation on 8/11/23 with Lori Ramsey. She's the chief nurse consultant of the Office of Commissioner. This talks about some of the things that school liaisons could do. Because I asked her if there's like a list that she could give me an idea of what kind of work this person could provide. Also in the core services document, there are suggestions made there. And that is referenced on that bottom line. But you can see that there's all kinds of ways that they can be of help to the schools. Their job is to be out in the public also, supporting schools. When there's a need, they could do a drive for like mittens and hats. And then we also will have money in the budget to provide supplies of different sorts if they need them. Like just recently, they were told they needed an AED every so far apart, distance apart. So that's going to be a new thing. It's a taxing thing for them. I don't know if they need assistance, if we can help them with part of that. I don't know, but we could provide services to them, like for screenings, things of that sort. We could provide materials for their clinics. Even the silly needs, like I said, the mittens and things like that when kids come. There was another thought that I had. I don't remember what it was, but a lot of that is explained on that sheet there. And this position is required to be at least a 0.5 position for all the schools. And there's some background information in that.
That covers all 5 school districts?
That covers the 3 big ones, plus the 2 private schools. Hamilton is being served, they're right on the line. So we flip, sometimes Steuben services them, sometimes we do. They had already reached out to them and she said, I'll take care of them.
Okay, good.
So we're down to DeKalb Central, DeKalb Eastern, Garrett Schools, St. Joe Catholic School, and Lakewood.
Lakewood Park.
We treat all of them the same. And the school liaison, they all have to have every service, they have to have the same ability to get a school liaison. So even though St. Joe Catholic School only has 88 students, we have the option of giving them money to hire one. But the issue would be the health department is responsible for all that money and making sure the position is only doing what is funded by the grant, and that the reporting is being done correctly. So that would give me 14 schools that I would have to track and gather information and report to the state. Whereas if we have our own employee, which is the way the funding was meant to be, it's one person that would report directly to me. They would know all the work that's being done. They could do all the reporting to the state. So that's huge.
Might
as
make
far
your
as
life a little easier.
You what?
Might make your life a little easier.
A lot easier. And the main thing is we're still responsible if I find out after 2 months that one of them wasn't doing what they were supposed to be doing, which that's going to be an easy thing for them to slide into if they are actually on site at the school all the time. So this way it kind of protects everybody. Let's see. So this last page, on the top, it says school liaison community nurse. There are new programs within the funding that we are required to do. So the school liaison was the 0.5 we have to have. What I am proposing to the council is, and they're still looking at it, is having another 0.5 added to that position to make them a community nurse. The purpose of the funding is to get the health department out in the community more. And this position would help facilitate that. So like when we take vaccine out of the health department, we have to contact the state, fill out a big form to request the ability to remove vaccine from our premises, and then we have to report back once we've done it. It's a lot of work. It also takes time to schedule events in the community. This person could do all that, and then the rest of us nurses could show up to do the actual vaccinations or whatever health type thing we're doing. So this person would do the heavy lifting on the things that are outside of the health department. The other thing is the lead testing. In the paperwork, it doesn't look like it to you, but if there's no lead testing that is provided for free to all the community, the health department has to be responsible for it. So we're there. We have to be responsible for that. This person would do that. They would, through the health department, provide testing for lead for children for free. And of course, all this stuff, they would also be reporting to the state. So the third thing this person would do well, there's more than that, I guess. The fatality review corps that I was talking about. Trying to gather the partners together. There's a possibility Parkview will help with that, but ultimately we're responsible. So I want to make sure that we're prepared if this turns out to be what we have to do. They have to form the groups, make sure everybody's meeting on a regular basis. They have to write initiatives in the community to make sure we are moving forward on the tasks. And that's, like I said, that's a new program also. The other new requirement is the tobacco cessation and prevention. And all of these things I've mentioned are on that core sheet. Again, you have to be involved with the committee. You have to form it if there is not one, which we have one through Tyler Cleverly, the,
United Way.
yes, and he's also the tobacco, he's a lot involved with tobacco cessation in the community already. So he kind of has that going, but we have to be involved in it. We're required to be there, all these committees. So, and that again is, I'm sure if I recall, it is about initiatives being written, things of that sort. It also involves, no, that's it, sorry. One of the things regarding the school liaison portion of that position that I'm proposing, they are supposed to provide education on tobacco cessation and there's something else, I'm sorry, I can't remember what it was. But they're able to do that. I mean, they could either do programs or there are programs that are provided by the state to us. So they would help, they would secure that and make sure the schools have it. That's another one of theirs. Now, I know that's a lot of information, but what I was just hoping was that I could get you all on the same page so you see what I'm looking at and what I see as requirements for us, for the funding and for the work that we do. Do you have any questions on those? And like I said, you don't have to ask questions today. You can get a hold of me or whatever if there's things you want more information on. The main thing is we can't just spend that money on anything.
Right.
It is very specific. I tried to, there's some of our grants that are going to go away because of this. So I was trying to, as best I could, take stuff out of those grants and put them into this funding. It doesn't fit so well. And that's because these are programs that are new and they need the funding. They targeted things. So the stuff I've left in the 1159 is stuff, a lot of it is things that we've done in the past. And I've also had to put some of the grants that we've done in the past into these different programs. So I've moved money all over just because of the requirements for the funding. So when you look through the 1161 fund on the budget, that's Susan helped me get together. You can see where the money's going, or the proposed areas that I want the money to go into. And this is where there's a box that mentions some of the program fundings. Each one of the people that we're funding, the Y, Parkview, all those are all separate line items on this. So there was no way to get all the writing in there. That's why I gave you the other page that gives you more details for each program. I'm trying to look for the beginning of it. Oh, here it is. Okay. The first thing that I funded in the 1161 was the school liaison. And then I spoke with Susan in regards to insurance and Social Security and PERF to make sure of the dollar amount we might need if that is approved. The wellness program is a program that was funded previously in one of our grants and had to be moved. And it fit perfectly into this grant, or not grant, this funding. So I moved it into here. The school liaison supplies, those are for supplies that the schools might need, or services, whatever their needs may be. The medical supplies, NICS is a real important thing for the schools. That was in a grant before. I wanted to make sure we are still able to give that to them. There's vaccines in there. Those are not just for the schools. Those are the vaccines that we would use in the community. see. The health education supplies, that is from a program for the environmentalists. Kathy has a septic program, and those are the educational materials that she uses that money for. The St. Martin's, as you would probably saw in the funding programs, she wants to have a one day a week, they have a mobile unit that would come to DeKalb, move around like Butler, Ashley, places of that sort, and they can provide, what do you want to say, lab tests. They can do referrals for mental health. They can do physicals. They can treat for chronic and acute illnesses. So it's a great resource for people. And that would be free to the individuals who had the low income or uninsured or underinsured. The tobacco cessation, we talked about that through Parkview. There's the programs that we're looking at, and that's the one that I would have to shave down according to what the council does with wages. Vaping is a real problem in the community. So Drug-Free DeKalb, which was Tyler, he's putting together a program for that. And that will provide discounts for low-income people to be able to be involved in that. The diabetic, we talked about that, and the Y memberships. The environmental health care, these are supplies for the new programs that the health department's going to be doing. We are going to be starting up the pool, public pool, testing eyelash equipment. There's eyelash things that can be done at tattoo parlors. So they have to be involved in that. That's part of their supplies for that. There's testing for our wellness machines. We do the A1C and lipids free to the community. This is a service that makes sure that our machines are calibrated every year. The venues for the immunization clinics, so that we can compensate different areas in the county that allow the state people to come in or us to go in and do our clinics. The generators, this was like a savings plan, trying to have some money saved up to replace them in the future, which is kind of like what our capital gains thing is about, that we've been doing for years. There's also money in there for future replacements of our vaccine units. They're pricey. And then future vehicles. Right now, the 2 grants that we had, we have carryover that will be in those funds, and we are still allowed to utilize them. And they've purchased our vehicles in the past, and I intend for them to continue to do that, but eventually we would still have to have money saved up, building up somewhere. So I went ahead and put them in here. So that gives you an idea of where we are. And the total is $437,665. That is more. That is more than our, what do I want to say? It's more than what our match would have needed to be. But it's already in, we should be fine, because I'm sure there's going to be counties that don't opt in, and more money will come our way, and they're going to change it. So I it's going to let the council move things around.
Yeah, I think the numbers are fine. As far as what you're going to receive,
Yes,
and based on your projections.
yes. And like I said, I'll just have to adjust St. Martin's and the Parkview programs to be able to keep the budget where it needs to be.
So what really needs done is Cheryl has to turn in a budget to the state by September 1st. And in the second ordinance that was added to the approval of opting in, you guys wanted the information on what they planned to spend on by the end of the year. This year is a little wonky because of when it's starting and everything. So you guys need to approve or disapprove, whatever you want to do, what she's proposing so that she can get that turned into the state. And then the council will have the ability to move monies around if needed, if her plans change with you guys when they work on the actual budget numbers in September. So she's got to get something to the state prior to us working on the budget numbers. But for this year, it's way ahead of when you guys had asked for the plan to be done by the end of each year.
So, give you an idea, like purchase a vehicle is $12,700 per year, I assume.
And we
Where does
may-
that money come from? Is that from the grant? Or
that is
That's all
put
from the
into the
grant.
funding.
that's all for
Yes.
from the additional money that we're
Yes.
getting from the grant?
They allow
That's not the
us-
40%, that's the 60%?
No, that's not even part of that.
Okay.
We are allowed 10% a year to be put towards savings for capital
Okay,
type things. So this is my 10%. I wanted to make sure that I was preparing for the future. So that's not included in the 60/40. The 60/40, and this is important because I know that there's some discrepancies on that, but it's very clear in the paperwork that 60% can be on nursing type things.
right.
Salaries, all that type of thing. The 40%, and you can go up to 100% on the nursing area. The 40% is the environmental side of those cores, which you can find them on that core sheet, and environmental salaries. So it's very specific. And as I write into the grant paperwork, it'll actually tally and tell me how much each of those, you have to put it in, like, is this part of the environmental or is this part of the nursing side? And then it's tallying below, and it'll tell me if I'm over the 40 or the 60%.
Very confusing.
It is. You should see the paperwork.
This is exactly why I was skeptical on this, because it's very, 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 a lot of work for you. I mean, it's insane, and I just wonder how much of this is money's being eaten up in administrative and extra work, and how much is actually gonna benefit people. And that's why I actually need a little more time to really digest all this, and that's why I was kind of adamant that we have a little control here, because we're getting $500,000 and we're making a budget of almost $500,000 here, and this much going here, this much going here, this much going here, and I'm like, wait a minute here, what are we really looking at? I'm not discrediting you at all. I'm just saying this is very challenging for us as elected officials.
But it is, and what I would want to emphasize is that those programs, when you read those programs, they are right in line
Yeah.
with the core services
Right.
that we are required to do. I was very diligent to make sure, because we have things we have to do,
Right.
those are in there for a reason.
Okay.
So,
Well, every dollar's accounted for.
Oh, I'm not saying it's not
Right there,
accounted
so-
for. I'm just saying we need to make sure we're using the money for the best use that it was intended for. And that's your job, of course. But, you're not a business person per se. You're a
No.
health provider. And we're here to account for the people's tax money, and I just want to, I need to understand this a little more. I mean, this is the first time I've seen these numbers, and the state wants an answer September 1st, of course.
And that is considered a drop dead deadline.
Let me ask you a question here. If you ask, or if you give them this preliminary, here's what we think we're going to do with the money, they send us the money, let's say we don't spend the money, what happens then? Let's say we adjust these numbers some other way and we don't spend all the money, what happens?
It's ours.
Ours to keep.
It's ours.
All right.
Yes.
That's the way I thought it was. I just wanted to make sure.
Yeah.
So this is a proposal of what we think we're
Proposal.
going to do
Yes.
with the money.
Right.
Might be a better option.
This can all be moved around
Yes.
as you progress.
Yeah, that's what I needed
I
to
am
know.
absolutely sure of that.
Oh, yeah.
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 And
I
we've
appreciate you
talked
doing
to
all
the
this work,
state.
by the way. I know this has been a real,
has
a real
been.
burden for you. And so I'm not trying to downplay anything. I'm just
No.
telling you the concerns I've had from people emailing me is, well, I'd like you to review the budget well, Todd. Well, it's hard for me to review a budget in 8 minutes, you know, of $500,000. And what is today, the 21st?
Yeah.
So
Yeah.
we have another meeting that we can have to,
Yeah.
I just think I
Right.
have to go through all this information. There's no way I can make a qualified,
I find it kind of odd, we were given a September 1st as opt-in date. Now they're telling us September 1st, you have to submit the budget.
yeah.
What if we had an opt-in until September
Must be a
30th?
government program, huh?
Or August 30th?
I would like
like-
to just emphasize the fact that I've targeted low income.
That was a concern of mine.
I've targeted people having difficulty getting to the health department by having a mobile unit. I've targeted tobacco cessation. I've targeted obesity in the
diabetes.
funding. I've targeted trauma and injury prevention through the bicycle helmets, bike safety, safe sleep, car seat checks. I've targeted maternal child health through this funding. The drug-free DeKalb is the vape program, which is big in the county. And again, the diabetic is also addressed in the Y, and the exercise, which would be targeting obesity. So I was very, I don't know, focused is the word, but trying to stick right into where the money is expected to go. So,
Susan, where are we at with council on this? Because obviously, council's the one that has to approve the budget anyway.
Right.
Well,
So
They-
they've had their first meeting.
we had budget presentations, so I have to advertise monies ahead of their September budget workday meetings. So I will advertise what she has presented, and then changes can be made after that. They heard the presentation, but they also know that you guys wanted to approve it, so they know the Board of Health, and you guys needed to approve her proposal before they know whether to fund what she presented.
Well, just my thoughts is that it's pretty obvious that you've got things going in the direction, I mean, just going through these line items here, the direction that we need to go. I don't see anything out of line either in the numbers or where they're going. This is not a locked-in budget anyway. You know, as Susan said, this is a proposal, and council's going to have to act on it anyway.
When is council going to act on it, though? Do they have to act on it by September 1st?
No, they have to act on it.
We have final adoption at the end of September.
Yeah.
So September 13th, the 12th after their meeting, and the 13th are public hearing days. That's when they do budget cuts, is what they all say. And then September 26th, yeah, the Tuesday, is the final approval of the budget. Then it gets all submitted to the
So the
state.
proposal has to be done by the 1st, but
These are two different things. I have a section that we have to do as county council budget. She has a totally separate, different thing
This
that she
proposal
has
has
to
to
give
be
to the
to the
state by
state.
September 1st.
that's what I'm saying. This has to be done by the 1st.
Correct.
The state proposal.
Correct.
Our budget's a separate issue.
Which that state proposal is what tells me what she's wanting in her budget.
But we have a meeting on the 28th, so that gives her
Yeah.
the rest of that week to get this in.
Or 3 or 4 days anyway,
Well,
or
yeah.
3 days,
Yeah.
yeah.
It's going to be very difficult because I'm working with 3 groups of people,
Sure.
the board, you guys, and the council. That's 18 different people. And we're under the gun. I don't know how much I can go back and forth in that little bit of time to accommodate everybody this year. I don't know
that there's much more that you can do besides presenting it to all the bodies, and when they look at it, if they have questions, then they'll have to ask the questions in time for submission by the 1st.
yes.
I mean, I have to advertise no later than 28th. So I have to put something in no matter what, or we look at doing additional appropriations next year, which is something the state does not want because it costs
We
money.
have to advertise on Monday.
I have to
by Monday.
advertise no later. I have to sign I shouldn't say advertise, I have to sign my little form with DLGF, and that satisfies my advertising deadline. We used to have to put it in the paper, but I just have to submit a form on DLGF on the 28th because it has to be done 10 days prior to the first public hearing day on the 12th.
I have a question that doesn't really relate to this that maybe you can answer for me. What vaccines are required to attend public school as a child?
Oh,
I mean, is there,
there's probably 10 or so at least.
do you administer those? Or does your local doctor do it?
We do
I haven't
it.
had a shot in 40 years, so I don't understand.
We do it.
You do
Yeah,
it? But
of course, uh-huh.
And then, so if someone would come to you for those vaccines, if they can't have their doctor do it,
That's what we do all the time.
that's what, okay,
Yeah, we take care of Medicaid people.
okay.
We've also, people that are uninsured. We also take care of private insurance. We've started billing the first of the year. We took on that. That's,
So you actually charge for that service?
the billing for people with private insurance, a lot of the immunizations are already covered. They're supposed to be covered.
Okay,
But we do bill, so the insurance company will pay for them. But as far as us charging people when they walk in the door, we don't do that.
okay.
Yeah, we don't do that.
Do private schools require that same immunizations also?
Now that, I don't know. I don't know. I didn't even think about that. It's never been asked.
I believe they
Before.
do.
Do they? Okay.
You think they do, Susan?
I think they do.
If they didn't, they would be at a big risk.
Are they ever given any immunizations at the school? Are kids able to get the vaccines at school, or do they have to get it at the health department or their doctor or CVS, or do schools actually administer vaccines, I guess is my question. School nurse.
We used to administer in the schools. We can, but there's hesitation by some people, like the council, about going into the schools and doing it. And I will say that we have a little reservations ourselves because of parents not being there.
Does a parent have to authorize it?
Yes, of course.
They do have to authorize it, okay.
Oh, yes, yes.
Good. All right. Like I said, I haven't had a shot forever, so I don't know, other than,
Yes.
you know, okay.
I'll talk
Yes.
to Dr. Sutter about that.
Yeah, I know. Oh, he'd love to, trust me.
Yes.
Okay, all right. Great. That's all and I have the list now. Susan gave it to me on what's required, so I appreciate
How
that.
did you do that?
It's amazing.
I have children.
Yeah, yeah. So
I say I could list them all, but then I would wonder if I was in the order that they're needed.
basically measles, polio, Hep B, and polio, it looks like you get a booster for polio as you go,
lot of
don't it?
them.
Yeah.
Menactra, Tdap,
And what's Tdap?
that is tetanus.
Oh, okay. All right.
Tetanus, diphtheria, and pertussis, all
All right.
mixed into one.
Oh, I see it,
That's
yep.
a whooping cough,
Yeah. All right.
MMR.
Little tetanus is good for you, isn't it?
Well, yes, that is good for you.
All right. Okay, that's all I had.
Okay.
Appreciate it. Thank you.
Sure. So I guess I need to know after I leave, do I need to do something else as far as you guys? Because I'm not sure. I need to make sure.
I just need to read it all very well, but I'm okay with what I'm seeing. I just need to read it all and make sure I understand it. That's the thing. I hate making a decision on something that I don't fully understand, and
Yeah.
I think I'm getting there. Yeah.
This is going to take,
This is going to take me a little time to read. This will be good reading for me. But if we act on it next week, that gives you time by the 1st to submit, and that's the preliminary, like Mike said, and it can be moved around later if we
Yeah, all
need
this,
to.
all this funding can.
So
all
I have
of
no
this can be
problem with
done.
that. I just want to read it to make sure that I completely understand what I'm doing before I give my okay on anything.
So just to be clear, because I don't want to add any more to your stress level, what else do you need to do besides our approval? I know council has to approve it,
Well, I've
but
also
but if you
been,
only have 24 hours after we approve it to do something or,
right.
you know,
Well,
So-
I wouldn't even have 24 hours because let me think about this. My my board is meeting on Monday night. That was the
That's on the
quickest that we
28th.
could get that one pulled together. I got this, that was added in on Wednesday. And then I was also asked to revise the health department job descriptions. So I have been feverishly working, trying to do that to make sure they're an accurate depiction of each person's work. Because the council not only wants to look at the wages for the environmentalists in the front office, they want to see the job descriptions, which the nurses don't need to be updated, but they want to see those plus the new position. I had to write a new job description for the position, the 1/2 school liaison, 1/2 community worker, because they want to make sure it's justified before they approve it. So I'm deep in that. The grant paperwork, I haven't even started to put all these figures into it, and it is massive. I'll just tell you, it's massive. The sheet is about that long, and there are probably 8 to 10 pages that wide. It's a lot of work, is all I can tell you.
so this is part of your board meeting then on the 28th as well, presenting this and
Yes.
getting your board approval.
I
So
actually had-
We kind of left the Board of Health out of the equation here because that's actually the governing body.
Right.
That is,
But your board is the one that, you worked with your board to come up with this proposal, correct?
No,
I
you
did
did not.
that.
she has to
And I
present
got
this
to
to her
submit it
board
to
for their
them.
approval.
So you didn't work with Mark on any of this? This was
He
all-
knows about it all.
He knows about, okay. Yeah, because he sent me a text saying, hey, we're working on the budget. And
Yeah. He knows about it. I've gone through every line item with him. I'm in close contact with him.
Okay,
That's different than the board, though.
okay.
Yeah.
But Mark's on the board, correct? Dr. Souter?
He's not considered on the board.
Oh, he's not on the board.
He
He's the
goes
county
to the
health
meeting.
He's the
officer.
officer, but he's not on the board. He doesn't sit
Right.
on the board then. Okay.
He attends. He's always involved, but
Yeah.
he's not a vote.
He's not a vote. Okay. All right.
Yes.
All right. I misunderstood that.
Dottie, you had a comment or question?
And because the Job Classification Committee, we are meeting on the afternoon of the 29th, and the school liaison position is on the agenda. So before they really do too much going forward, they need to have you approve the position. What do you guys want to do? And Cheryl has received from me several examples of this position that other counties who opted in much sooner have already created their job description for the school liaison / community person. So what I need from you is, maybe not today, but yes, we want to create that new school liaison position so that then the job classification subcommittee can look at and possibly even, keep fingers crossed, the job description so that it can be moved on then to the consultants.
So how many positions are we actually creating then, Cheryl, total?
Just one.
Just one.
Just
And
one full-time.
And that would be a divide of school liaison, and what's the other facet?
Community,
Community.
where she would
Community nurse.
facilitate all those clinics outside. She would plan them, do all the paperwork to move vaccines. She would report back to the state about that.
Okay, so
And
this
then
is
the
what
rest
we-
of us would go and do the
What she
vaccine.
presented earlier.
And this is what you and I talked about a couple months ago. We didn't talk about the school liaison, but we talked about that position to handle the paperwork and the
Oh, yes.
reporting. That is that person, correct?
Yes.
All right, I'm
So
just
that-
making sure I understand. All right,
Yes.
And
okay.
this person would be hired with the understanding that if the
Grant goes
health
away.
funding dries up, that it's very possible that they would be out of a job, correct?
Well, we live in an at-will employment state, so we're all like that. Those of us who are not elected.
Yeah, but that, we talked about that being an upfront part of the.
Yeah, okay, I understand that position now.
Well, okay, well, I certainly don't have any problem approving that.
Yeah, I don't have a problem.
Today.
That's a requirement of the funding
Yeah.
anyway, to have the school liaison, the way I understand it. So I have no problem approving that position, like Mike said, because we did discuss that. That was going to be necessary to have, because you can't handle that. I
Right.
mean, so,
Okay, so here's a couple other things you need to think about. The bill is lengthy. It's not, in one place they say that as a shall, that we must have this. In another place, that's not what they meant. They didn't mean it as a requirement. It would be very, very smart to have that person locally with us so that we are knowing all the requirements are being, funding, all that stuff, the reporting. But the other thing that you need to think about, not just with Cheryl, with anybody that's wanting to add, because this employees discussion came up after presentations on our flow of how we do this. So we need to think, is it, like, do you guys really need to approve adding a person if council isn't going to fund it? So are we doing things backwards?
and this has always been my problem with this whole process.
Because if council isn't going to fund it and you guys say yes, well, it doesn't matter, council's not going to do it. So
But
it's
we-
almost like we're doing things backwards.
But we have to let them know that we would like to see that position for them to consider funding it. You know what I'm saying?
Well, that's how it's always been done.
Yeah.
But that's not necessarily the best way.
Oh, I agree with you.
I mean, it could be that that the departments go to the council and say, this is what I'm wanting to do, are you gonna fund it? If they say yes, depending, contingent on your guys' decision, then they could come to you and say, okay, council told me that, yes, they really will fund this. Where right now, we're working at it in a backwards
Well, I know, but
manner.
I think we need to let council know that we're willing to create that position.
I think so. I mean.
If we
they're
don't
not
let them know
gonna-
we're
They're not
willing
gonna
to create
fund
it.
something that
In this-
doesn't exist.
Yeah, in this instance, I think definitely we need to,
Yeah, but they need
to
to have,
let
needs to
them
have
know.
some
I mean,
input.
we can,
Yeah, we gotta let them know so they can fund it. Otherwise, they can say, okay, yeah, we'll fund it, and then it comes to us anyway. Okay, will you create the position?
Yeah.
It's, one of us, both of us have to approve it.
if you can't or don't end up needing to fill the position, it's a moot point anyway.
Yeah.
So,
I get your point, though.
yeah.
It's why we need to just have 5 commissioners and no board, and the commissioners be the board, just like normal states do. But anyway,
I think there's some
Good luck
thinking with
getting
that.
through the
I think there's some more discussion that we need to have with that piece of it.
yeah. And again, I think we can do this all next week. We need to talk. I need to talk to Cheryl a little more about a few things I have questions about. And I think we can do this all on the 28th. And we can't kick the can there, though. We have to make a decision on the 28th.
Sounds
But
like.
we will get this done. And
Okay.
by the 28th, I think, I'm speaking for myself anyway, I will do my part to get this done. But I'm going to talk to you also.
Can you, okay, let me ask this. I know that you just have this, the budget part of it. Knowing what did you tell me? The categories that she emphasized so far. Would it be a waste of Cheryl's time to start her filling out her grant paperwork and then make minor changes? Or do you think you're gonna rehaul this entire thing and she's gonna have to redo the whole thing?
I think she should start on it.
Because the paperwork takes
Yeah.
forever.
I think,
Well, it has to be handed in.
yeah, I
I
think you
don't
should
have
start
time.
on it.
I
'Cause
think we're going in the right direction. I think it'd be foolish to try to second guess a department head and revamp this whole budget.
I have no intentions of changing your preliminary numbers. We need to get it submitted. That's not a problem. I just want to make sure I understand it before it's submitted, but I think it would be wise to start filling it out and get on it. And, because I have no intention of saying, oh, no, move 10,000 here, move forward, but I want to make sure I fully understand it before I okay it, is what I'm saying.
I totally
I think
understand.
that's great.
I totally understand that part, but Cheryl needs to
You should start
feel-
filling it out.
Yeah, that she
Yeah, well,
doesn't
that's-
have to wait. That's why I'm asking a
Yeah,
question.
I think so.
I would say
Bill?
absent some big surprise as we go through the line items here, you're exactly on track, as far as I'm concerned.
Well, I suggest we do it sooner than later, so we can get back to her if there are any changes.
Right.
We'd like to see.
But don't you-
But to say that this is cut and dried, I don't go for that. I really don't.
That's not what I'm saying. I'm just wanting her to feel like she can even start her paperwork instead of waiting until
Yeah,
the 29th after all these boards meet. If she can at least get it started and then maybe make some changes here and there, it would help her time-wise.
We have a consensus there that she should at least start filling this out.
It's
and
not saying that everything's cut and dry. It's just that she can start the
I
paperwork.
think so. I think that's just common sense.
right. So that's a consensus. Go ahead and start the paperwork, and
Does that
we will
help?
get into this
Yeah.
just as quick as we
'Cause
can.
it-
And
It's going to be a long process
Sure.
to type.
I thought so.
any other questions, comments?
No?
I have one, the car seat checks.
Yes.
Is there any, can you give us any details on that, and who would perform those checks, and what would the circumstances be?
Parkview is going to offer that to the general public. People would come through, they could make sure that it is a seat that is still up to standards or code. And then they would make sure that the child's put in there correctly and secured correctly. Sometimes they're supposed to face the back, sometimes the front. That type of thing, just to ensure that the children are safe. And they would definitely do that for their OB department, but their OB department, I've heard, is
Yeah.
dissolving. So
Really?
Yeah, it's going to
Them and LaGrange.
PRMC and
So
Noble and it's DeKalb and LaGrange, I think.
it's DeKalb and LaGrange, as
Yeah.
far as I know.
Yeah.
You would think that's a very simple thing, but car seats are very,
They're
very precise how
complicated.
they're supposed to be strapped down and when they're younger, they have to face backwards. and-
Yes.
Yeah, I mean, that's a fairly important thing.
Yeah. I know.
When I was a kid, we just crawled around in the back of the window,
Or
and
the
I'm still
front,
here.
or the front,
Yeah, front, on the floor, hung out the window,
all the knobs.
Yes.
I know, and I don't know if they still do or not, but if you have to cut somewhere, Kiwanis used to do the bike rodeo.
Yep.
And Tom Mason and Joyce Hefty would buy helmets and give those away, and it was all a free
Yeah.
event, bicycle safety.
When I
thing
was a
too,
kid,
so-
we even got a sticker for our
Yeah,
bike.
yeah,
You
yeah.
showed up, you did the bike rodeo. They didn't give us helmets then, but that was
Yeah.
back in the 70s. Our heads were harder back then.
Well, yeah.
But,
Yeah, but Tom Mason used to buy all
yeah.
the helmets.
Yeah, so there's an option too, yeah.
Well, we were buying the helmets, so that was part of the funding.
Okay.
So,
yeah.
yeah.
Okay, anything else?
Cheryl, I really appreciate the work you've done. I know it's been, I remember sitting in your office and that stack of papers, and that didn't look fun to me, so.
Well, we
Sometimes
will
me
do our
neither.
best not to put any hitches in things and get you out of the gate in a timely manner.
Yeah, yes.
Well, like I said, I have no problem with this proposal once I read it and fully understand it, especially if it can be modified if we see anything, wait a minute, this don't make sense, but I'm not gonna second guess you on your expertise there. I just wanna make sure the business model per se makes sense, okay? That the tax dollars are going where they should, so,
Okay,
all right?
thanks, Cheryl.
Are we good?
Yeah,
I think-
thank you very
Okay.
much.
Good to go.
Pleasure to meet you.
Thank you. It's nice
Good
to meet all
luck.
you guys. Thank you
All
so
right.
much.
Okay.
See you, Dottie.
All righty, we got a little bit of time, miscellaneous topics.
Can we get Anton in real quick? It won't take
So,
long at all.
yeah,
If we can do that before
Anton.
the break. And Tori? Tori showed up too. Okay, all right.
Sign in here. Well, good morning, Anton King, DeKalb County Economic Development. Proposal to pursue brownfield assessment and grant through the EPA. We have, our office has been approached by, the town of Waterloo, Pam Howard, the town manager there, back to last year, if you will, to look at brownfield assessment opportunities that sit across DeKalb County. For context, brownfield could be a blighted area, maybe a former gas station, or basically an area of development that hasn't been able to move forward in a development process for whatever reason, whether it's environmental or just plain stigma. With that, we thought in talking with Pam and then Commissioner Sanderson that we could potentially apply as an entire county in that sense to stretch those dollars and have really a stronger application if we go for an entire county and the communities within with a handful of partners in that process. The consultant company that we've initially been working with early on through a recommendation with the town of Waterloo is a company called BCA Environmental Consultants. They're based out of Indianapolis, and they do have really have kind of laid out a plan of what that looks like to apply for this program. Overall, the total dollar amount that we could receive is, our understanding is $500,000 that can go towards phase one funding, phase two funding, community assessment programming. Pull my comprehensive list up here so I make sure I don't misspeak. Okay, the $500,000 can be used for brownfield brownfields, the inventory of those brownfields, phase 1, phase 2, remediation, cleanup, and planning, and also can help support community engagement events. So in working through, a specific brownfield site for the revitalization, through that process, we could would have the opportunity to hold a community event to get community feedback, to understand what the community wants to see that area potentially be. It's been, we've been advised by the BCA consultant group to apply as a coalition as opposed as a single entity. Coalition has a stronger, really a more collaborative, the more groups you have in on it, better. We've been advised to kind of cap that at 3 groups. And so the proposal for, in this scenario, would be DeKalb County, the Town of Waterloo, and the DeKalb County Economic Development Partnership as the 3 coalition members, with the county being the lead applicant in that process, if you will. We have assurance from the consultant group that they would do the heavy lifting from the paperwork perspective, as far as applying for that application, which is due, I believe, in November of this year. So essentially, the key piece in the initial application process is, I'm going to say, basically an interlocal agreement between the county and the Town of Waterloo. The nice thing about having the county being the lead applicant is that it would encompass the entire county's jurisdiction. So those other communities that are within that in that jurisdiction, Butler, Garrett, or Town of Ashley, etc., they would fall in the pool, if you will, to be able to utilize those funds for these brownfield type projects. It's kind of the high level overview, if you will. We understand that through that process, we would have, after a grant is received, should we receive, we essentially have 4 years to utilize those funds throughout that process, and then whatever is not utilized then gets returned to the EPA through that process. But in that grant cycle, really pays for any funds occur that would happen through that process. And so our understanding is there's no out-of-pocket expense from the county's perspective, from our organization's perspective. Those funds from the EPA would be utilized to help pay for the consultants' work that they're doing, the compliance, and those types of operations in that. So that's essentially kind of a high-level overview of it, but my request to the commissioners this morning is for your consideration to move forward to apply for the funding. It's a highly competitive process across the entire nation in that sense. Just to give you some context, there were, in 2022, there were 438 grant applicants nationwide, and of those, 237 were funded. So, a little north of 50% of those applications were awarded. And they did $147 million worth of awards from the EPA's perspective nationwide. And of that, 13 of those grant applications were from Indiana. So just want to provide some context for you there. But again, the main point is to secure funding locally from the EPA that then we can use to basically assess, remediate, and bring online some of these dilapidated or brownfield type sites across the county in that process.
We had a good meeting. It's a good program. It doesn't cost the county anything. We're the lead, of course. We bring the big numbers in to get the grant. And then the good thing is if we get these brownfields converted, maybe get a new business on there, get the tax revenue back up, clean up the land. And there's 4 pots of money: report, site work, community engagement, cleanup planning. And it's BCA would also handle, that's the organization we'd work through to handle it. They would handle all the quarterly and yearly reporting to us. There's nothing we have to do.
We are up against the clock for break, and let's come back and hash this a little bit more.
Yep.
Okay.
You guys stick around for a little bit?
Thank you.
Mike's off.
Mike's off.
In their You want to shoot me a copy of that paperwork from? Used to do not familiar enough with it that I little out of my expertise. Off whenever you. Okay, that makes sense. I wonder, yeah, that's great. I mean, that's great in the sense that you're recognized for your work.
But it,
You go to the meetings?
Task force, yes, I am. Yes, I am. So, can we, can we find $29?
Should get this passed through. I would check with, if I were you, I'd check with these just to make sure that this is fine. If I
Give somebody really bad advice.
Huh?
Give somebody really bad advice.
Right. So like, your bond, right? I would make sure that your bond covers this, because it's not county work. Something outside the county.
Rank us up, Susan. Okay, we are back. Do you want to take care of that grant, brownfield grant, real quick?
Take care of what, I'm sorry?
The brownfield grant,
Yeah, I will.
Anton.
We're back on, right?
Right.
Yeah.
Just so the audience all knows too, what this is the county being the lead for the grant. We have no financial responsibility, and the reporting would be done through BCA. They would handle it between the partnership, and I think it's a good thing, and I would make a motion that we be the lead to pursue the grant through the EPA.
I will second that.
Okay, we have a motion and a second. Comments?
I would comment that Waterloo just dealt with the S&S gas station, and that apparently was a brownfield, and the IDEM had been in or something and got things cleaned up, and then Waterloo just recently was able to transfer that successfully to a private business.
Yep.
To be able to, they're going to go in and rehab it, and it's going to be useful then as a business.
Yep, it's a good thing.
So good for the county and good for Waterloo, so.
Yep.
Yeah.
Any other comment? All those in favor signify by saying aye.
Aye.
Aye. Opposed, the same. Motion carries. You bet. Have a good
Thanks,
day.
guys. Have a good day.
Okay, Holly. All right.
All right, Holly Albright, DeKalb County Clerk. You guys should have gotten, I forwarded them to Susan. We've got 3 annexations that the city of Auburn has done, and you guys, as Board of Commissioners, set precinct boundaries. So what we really want to do is just pull these into the city of Auburn so that our maps look nice and neat when you look at precinct boundaries.
I have no problem with that.
I appreciate that.
That's your motion?
Yeah, that's my motion.
So yeah, we
I
have 3
put in
different
there,
ones.
I have no problem with that.
There's an ordinance for each one of them.
Yeah,
Right,
red nose, kind of.
cookie cutter.
So there are Fall Creek and the YMCA going from Union 9 to Union 4.
Right.
There's Fuller Hefty property, like out on 8, going from Kaiser 5 to 6. And then another Smith property, I don't remember if I know where that one is, but it's going from Union 9 to Union 3, if you want to approve them all together, those are the,
All together?
I'd make a motion that
Places.
we approve all of them together.
Okay.
And I will second that.
All right, we have a motion and a second on the floor. Any other comments? All those in favor signify by saying aye.
Aye.
Aye. Opposed, the same. Motion
All right.
carries.
That's the quickest we've done.
I like that. And then you'll have them and send the originals to me then, Susan?
yes.
All right, thank you.
Yep.
Thank you.
Just my signature.
No, all three of you on the left side, on the front page of each on the left side.
Okay.
Yeah.
Got it. Wow. That brings us down to miscellaneous topics. What we got,
I have a couple when you're ready.
okay?
Of course you do.
I know, right? I'm always the problem child. The first one is easy. After you guys had approved the pharmacy agreement with Genoa Healthcare for community corrections last week, there was an amended agreement that had come through while we were actually in meeting that added they needed to add that the dispensing racks for the medications was part of the agreement. So I just need you to approve the amended agreement that added that and have Bill sign it again. Thank you.
This spill rack.
Yep. That's your motion.
Well, I mean,
Your motions are amazing, Todd.
you know. I like to keep things simple.
I know.
Fine with me, all my motions. Mike, you make a motion today. I'm done
It's fine
motion.
with me too, so
Yeah,
I'll
see there.
second this.
Okay.
You go second, his fine. Yeah.
Oh, you guys.
It's pretty preliminary. We have the,
You already approved it.
approved
We
the
just
agreement.
needed to add that amended piece to it.
I'd make a motion that we accept the amended dispill rack request.
Second.
that motion is second. Comments? All those in favor signify by saying aye.
Aye.
Aye. Opposed, the same. Motion carries.
Okay, I don't believe that we have anything to discuss on the Community Corrections Building update email that she sent us because I asked her if she had heard back from
Right.
Fire Marshal and not yet.
Not yet.
So that takes care of that one.
And didn't I, if I understood that correctly, they can just relabel it manually instead of through the software, right? Possibly.
If the fire marshal approves that, yes.
Well, who's the fire, is it a state fire marshal or local?
Local, it's Shambach.
I will call Ryan and get that done.
Yeah, I don't know.
I know Ryan, let me talk to Ryan and see if I can't get that done, because I don't want any more simplex Johnson controls in any of our buildings. Matter of fact, I think we ought to really consider ripping the crap out and getting stuff that we can work on.
Yeah.
It's ridiculous. I mean, if you remember, they charged
Oh, yeah, yeah.
they wanted to charge $8,000 for a
that
display
monitor,
panel
yeah.
that was
And they went-
$600.
Right.
They went 2,000 to relabel this
Yeah.
panel.
That's almost monopolistic behavior.
Oh, they bought so what they did is Simplex,
The
they
problem
bought the
child.
company. And now that they bought the company, they jacked the prices up, tenfold.
It's not like monopolistic behavior, it is monopolistic.
It is,
It
but
is
yeah.
monopolistic
Yeah.
behavior, that's
Definitely.
right, that's
The
right.
thing is, it's not a big enough entity to, be antitrust by any
It's not going to be on the radar of the
No, it's
federal
not on the
government,
radar.
probably.
It's
but-
anything under $10 billion, I suppose is, but here nor there, let me talk to Ryan, see if I can't get that worked out. Say, hey,
Okay.
Ryan, come
What
on,
we
what can
gotta
we do
do,
here?
can we do it?
We don't want to spend $2,000 to have someone, you know.
And you'll,
And of course, he's bound by the state regulations too, but he
But he
should
can
be,
find
he
a
should be
way.
able to, yeah.
He can find a
and
way.
you'll
I will call him
be
today.
in contact with Michelle so she knows you're doing that?
He's a good guy.
Yeah. Yeah.
Yes, on Michelle?
Huh?
You're going to be in contact with Michelle so
Yeah,
she knows you're
yeah,
doing that? Okay.
Yeah, yeah.
All right, the only other thing that I have is the consignment agreement with Little John Auctions for the sheriff's car. I don't know if you all have looked at your email this morning,
Yeah, I got the email from Ben.
because Chief Rice emailed explaining why they were going with this option.
Right. Do we not buy cars from, I know that the sheriff forever exclusively used Auburn Chrysler to buy their, pretty much exclusively for most of their squad cars
Yeah.
and stuff.
Right.
Yeah.
And then as a side bonus, that entity would then sell the cars for them, which was nice. Do they not buy cars from the new Shepherds? Is that why they don't? Because if Shepherds
They,
is selling them.
okay, they do, but what Ben said was in the past, the Dodge dealership would take their decommissioned
Yeah, I read
cars
that.
to the auto auction, but the guy that did that no longer works there.
Right.
And I'm wondering if that's maybe
So I'm-
Ron Walter, maybe,
So,
you know.
Could be.
I don't know if Ron retired or not, but,
I'm just saying, it's a nice added service that if a dealership is selling you
yeah.
cars every year, if they could, it literally takes 10 minutes. You don't even have, matter of fact, the auction will even pick up the car for free. They'll sell it for you. They'll represent it for
They'll
free.
pick it up for free?
They'll pick it up for free. They'll represent it for free. You just pay the auction fee. So it's really not that much work, especially for a selling dealer that's selling us cars. But here nor there, I understood his email that this one's dilapidated. They've stolen parts off of it, on and on and on.
like they would, maybe
Stolen,
they
but-
didn't know that the auction people pick it up for free.
Yeah, I think we should just go ahead on this one since it's
Okay.
already in the works and let it happen. But I would really like to save us some money in the future by either working with I can call the new Shepherds and say, hey,
Yeah.
maybe we could both work out, maybe even through our business, I'll help get them through, if they want. But I really have a problem with $100 advertising fee and
Oh,
then
yeah.
15% on top of that.
We can't do
That's-
that as a regular method of disposal.
Well, especially on an old POS like that. I mean, if it's only worth $1,000, that's a 25% commission if you think about it. And I know that's maybe walking over dimes to pick up pennies, but if there's
Yeah.
a penny laying there, I'm picking it up. So,
Well, if that
All right.
doesn't work with Shepherds, John Moore might be.
yeah, that's what
willing
I'm
to-
saying. Yeah. So
Yeah.
I would make a motion that we accept this agreement through Little John's this time
Okay.
and get it done
For this vehicle.
for this vehicle only.
Okay.
This vehicle,
That
yeah.
I'll second.
Well, there was just one vehicle? I know there was another
Yeah.
one, but it's getting scrapped out or something. Is that the deal? There were two vehicles I saw. in
On
an
the email that I sent.
Oh.
That was just so that you guys knew that you
But
had
there
already
was just
approved
one
it.
car in the contract.
This is the only
that
one
I looked
going.
at. Yeah, and I looked at that contract. I'm okay with it.
Okay.
Okay. Motion and a second. Comments? All those in favor signify by saying aye.
Aye.
Aye, opposed, same. Motion carries.
I think it's,
Right here, I suppose, huh?
okay, I think you have to initial.
Who picked out the pink color?
Okay.
Purplish pink.
Looks beige. to
There you
me.
go, ma'am.
Does it?
Yeah.
Maybe my eyes need.
Anything
fixed,
else, Susan? Done? Todd, anything else?
Let's revisit Mike's request last week on the funding on the trail for that. Didn't Mike, refresh my memory, didn't we put aside money out of ARPA for trails? Didn't we, line item $75,000?
No,
You sure?
no, we took that out. Yeah, Susan's looking.
Okay.
But we took that out.
The only way I can see doing this is through ARPA money. I mean, we're talking about putting a road tax on for roads, because we can't pay for our roads. We're having people ask for 20% raises. on and on and on. Oh, yeah. Yeah,
It looks like
because I knew we threw.
we did a conditional trails grant match and engineering fees
Is that what it was?
of $172,575.
Yeah, but that was the Auburn Waterloo Trail. That grant's already been approved and,
Yeah, but nothing for
but we
this
didn't.
part.
Yeah, there was an extra few bucks in there and then we took it out and put it into,
Highway contingency.
yeah, that's
There
right.
was
It went to the
there was
highway
60 bucks
contingency.
left.
Yeah.
$60?
Out of that line item, we just put it in the highway contingency for now.
Can't do lunch instead?
Not for 60 bucks.
Well, like I said.
Where are you gonna go?
If the money was there in ARPA that I thought was there, I'd have no problem with it. But like I said, with this, us considering wheel tax on bills we already can't pay, I just have a hard time throwing more money at something. And I know you've worked hard on that, Mike, and it sounds like a small amount, but every penny's counting at this point, and I have a hard time approving that if we're gonna raise taxes on our people for our roads.
Well, I'm sure someone will pick up our tab,
Oh yeah, I'm sure,
one or the other,
I'm sure.
to be the only one out of 11 other governmental entities
Yeah.
to
I know it's
not kick
disappointing,
in.
but I have people just screaming at me about this wheel tax, and, which I get, and I have other people screaming to do the wheel tax, and the thing is, we're short on money,
Yeah, and people's asking, why are we even considering trails and our roads need a lot of money.
Well, I have no problem considering it. I'm just, if the money was there, I'd have no problem considering it because I can see some value in trails. But if we can't
Well, I mean, if
fund our
you-
roads,
Yeah, well,
That's the problem.
I don't argue with your logic behind it. I mean,
build roads with trails.
we can shift some of that ARPA money around if we've still got some sitting.
and I wouldn't be opposed to that if there's ARPA money we can shift. I have no problem with that. I just don't want to pull it out or light it or out of the general.
Yeah,
I'm okay with that.
Okay.
Yeah.
Work on that, I would think.
All right.
See if we,
I'm sure, because we have a substantial amount that we keep reserved for like the
yeah.
Oh, the audits and.
audits and
Yeah.
things
Yeah.
like that, so
yeah, which
Yeah,
that.
we've got-
I'm sure that
crazy.
tiny amount would be able
We've got
to,
400,000 in the audit fund, so.
And didn't they want us to do 800,000 initially?
They
Yeah, That
did.
was what they recommended originally.
Yeah.
I need to be an auditor. 800,000?
I'll take it.
Incredible.
Well, in that case, I would make a motion that we take $2,900 from the reserve for ARPA audits and use it for the Pocobosh Task Force contribution.
I'll second that.
And there still might even be extra in the highway part too, because
Yeah.
remember, I like condensed a bunch of little things
Right.
Yeah.
just
Do we have
put
a
it
motion
somewhere.
and a second? Are there any additional comments?
Little more comment. After we go through the audit process and we have, let's say the audit costs $40,000 instead of $400,000, can we use that other money then for other projects? Maybe
Yeah.
highway, something like that?
We may never even have an audit.
That's what I'm saying. Yeah, but we have to keep it, but do we have to spend all
We
the money?
did have, part of it was in my federal audit for 2022. They did part of it, and I just got that bill, I believe. The portion I could put towards that was $7,900,
Okay.
but not $40,000.
We have got until December 31st of 2024 to move that money around for other projects. That's, all the money has to be allocated to projects by December 31st of '24, except I think we can hold that audit reserve
Okay.
after that date.
And then
we can
spend
use
it later?
yeah.
We don't have to give it back, is
Right.
what
No,
I'm saying?
no, it's
Okay.
not
Correct.
reverted.
Right,
Yeah.
right.
I have no problem with that motion in seconds.
Okay, any other comments? All those in favor signify by saying aye.
Aye.
Aye, opposed the same, motion carries.
Great.
Thank you.
Anything else?
The will, there's a way.
Indeed.
Mike?
Where there's a lawyer, there's a will.
No, but where there's a lawyer, there's a bill.
There you go, that works too.
Andrew, you have anything?
I do not. Well, I mean, just to touch on, we've got the Todd Land lawsuit going on, but we've got the attorney working hard on that case, and so I think that's going well at this point. Some good arguments on our side. So other than that, I would just say, I think that pretty much covers it.
And when he presented, we didn't take an official vote. It wasn't a hearing, so we didn't have,
we didn't- there
it was
was no-
just him presenting.
No public hearing.
Yeah, I just wanted to make sure we clarified that.
Yep.
No evidence presented, nothing
Yeah,
else.
and the original driveway permit from 2011 on the drawing showed the driveway at the very bottom of that hill. And then he chose to put that pond there,
Right.
which he says he had, if I believe correctly, he said, well, it was originally the driveway was supposed to be here, but it didn't end up on the print that way. And I thought, well, that needed to be
Well,
caught then.
you know,
I hear a
so-
lot in that email of, it was said, but nothing in writing. And as a lawyer, we all know that it doesn't matter what is said, it's what you signed, right?
In writing, yes. I mean, I think that in this situation, the argument is going to be that the proper processes and timeframes for appealing the decision was
Okay.
not dealt
All right.
with. There's a lot of technicalities that go into that on this particular situation. And they did also withdraw their motion to, they had a motion to change to Allen County.
Right.
Yeah.
And they withdrew that motion. So,
Okay,
yeah.
thank you.
I think that's it on litigation stuff.
Good.
I do think your recommendations that you put out on process are good ones.
Okay. Yep. Thank you.
Anything else? I have just one item, highway garage build meeting last week. Ben discovered another mistake
Really?
in the engineering process out there. They cut that concrete in the existing Henderson building for all the drains for the new restrooms and the break area. He walks in there and he looks at this dig out that they dug down to supposed grade for this drain. He looks at that and says, that can't be right. It's 2 foot too low. It would not have drained into the sewer pump.
It's gonna be higher than the sewer.
It's got to be higher than the sewer pump. They had to go back in and fill that in with 2 foot of compactable and then plumb it. So that's about the third.
Our civil engineering has kind of
Yeah.
dropped a ball or two there.
We are requesting, or FCI is requesting an on-site meeting with this engineering firm. Hesitate to identify at this point, but we're going to get this ironed out and they're going to do their job, or we're going to start looking at withholding funds. Because
always
it's gotten
told that-
ridiculous.
Crap flows downhill, not uphill, so.
Yeah, I mean, it was just a mistake that shouldn't have never been, I mean, you know, like you say,
Who caught the mistake, Ben?
Ben did.
Why didn't FCI catch the mistake? They're the general on this. I mean, they're the,
I don't know if they'd even
they
walked in
might,
and looked
yeah,
at
they
it.
probably hadn't seen it
Yeah.
yet. Okay.
I mean, you know, the plumbing, Bangor had went in and
Yeah.
they assumed it was too grade.
Just going to print, yeah.
Yeah.
Oh, kudos.
Didn't Ben catch something with gas lines or something being right next to a garage door? And then,
Yeah.
Yeah.
I just want to say, before any decisions are made as far as, you know, enforcing things under the contract, I'd be happy to help look at that because usually there's technical things like you got to give 30 days written notice of this
Yeah.
is a problem. You can't just say,
Right,
we don't
right.
like what you're doing and goodbye.
Right.
You got to go
Yeah.
through the processes of the
Well,
contract. I'd be happy to help with that.
We've incurred
so.
some additional expenses on this and the
Yeah.
people responsible for that should.
Yep, I'd be happy to help with that, but there's little technical details that you have to follow or they can,
Maybe
maybe
get with
ignore
Ben,
it.
get
Yeah.
with Ben on that. Yeah, that's the third.
Unfortunately, this isn't an isolated situation either. Got the same problems on the catch and drain
Yeah,
and some other things too.
so, okay.
Kudos to Ben for going out there and,
Yeah.
and using common sense to say, wait, this don't look right, you know.
Well,
so-
he's got some knowledge that.
Well, he's went above and beyond, in my opinion,
Right.
to
He
make sure
goes
that
out
this
about
is
every
done
day.
right.
So anyway, anything else?
Nope.
I don't have anything.
We are adjourned then. Thank you, everyone.
All right. Oops. And